This is Dr. Maya Bachour from Loudoun Smile Center, and I'm here to answer some of the most common questions we receive about oral cancer. Oral cancer is the type of cancer that involves the oral cavity, so basically the cancer that happens in the mouth. It does fall under the big general umbrella of neck and head cancer. The cause of oral cancer can be either smoking, it could be heavy consumption of alcohol, but it also can be some infection, especially infection with HPV, or it can be some chronic irritation. Some of the early signs of oral cancer that patient can look out for are some lumps in the mouth or the tongue or the roof of the mouth, maybe ulcers or abscesses that does not heal for over 2 weeks. It could be difficulty swallowing, or it could be irritation in the throat area. Again, we're looking for signs that are unusual and it's staying the same or not improving over 2 weeks period. The most common symptoms of oral cancer will be red and white patches, changes in the tissues. It could be lumps that you can feel underneath your jaw, difficulty swallowing, irritation in the throat, ulcers anywhere in the mouth that does not heal in 2 weeks period. The early stages of oral cancer can look just like any irritation in the mouth, like a small ulcer or the type of swollen lymph node that you will get if you have a strep throat, or it could be some lumps, minor lumps that you feel in your cheek area, tongue area, the floor of the mouth underneath the tongue, or the throat. Oral cancer can appear anywhere, but the very back of the tongue, on the sides, or the floor of the mouth is probably the most common areas for oral cancer to appear. A lump on the gum could be an early sign of an oral cancer. Now, what's the connection between HPV and oral cancer? HPV, especially HPV 16, is involved in mouth infection. So this kind of infection can lead to oral cancer. Mm-hmm. How would we diagnose an oral cancer during a dental visit? We would, in every dental visit and every hygiene appointment, you will receive oral cancer screening. And the screening involves visual screening, when we look in the mouth for anything that does not look normal, like change in the way the tissue look or the color of the tissue. There is also a physical screening, which is basically palpation, when we try to feel underneath the jaw area and feel inside the cheek area. And now we're looking for lumps, for lymph nodes, for unusual tenderness or hard tissue that are there. Mm-hmm. When oral cancer is diagnosed, there are multiple treatment options. It can involve either chemotherapy, surgery, radiation therapy, it depends, or immune therapy. It all depends. Targeted therapy depends on the type of oral cancer and the stage it was discovered. Early detection is everything. The earlier we catch the cancer, the easier for us to treat it. Early stages of oral cancer are kind of tricky because they can be asymptomatic, which means basically you're not aware of it. Mm-hmm. But if caught early, oral cancer can be treated. I hope I was able to answer most of your questions about oral cancer. If you have any other questions or you would like to receive a screening for oral cancer, please reach out to us. We're always here to help. LoudounSmileCenter.com, or call us at 703-297-4407 and just basically simply ask for an oral cancer screening.